Namaste and very good morning to all of you, all the dignitaries of the dais, ladies and gentlemen. On behalf of National Medical Commission, I extend my gratitude to business world and certainly my previous employer, Cadila Pharma. You'll be surprised at how the doctors can be employed by a pharma company. Actually, I worked for Apollo Hospitals for almost 15 years, and the Cadila Pharma was a partner to that hospital in Ahmedabad. So a lot of understanding of interprofessional links and connects I have learned over the time. And I have also learned over the time the importance of both the system, private system as well as the public healthcare system. And I'm trying to ensure that if you can benefit by integrating these two parallel systems for the purpose of medical education as well as making the better healthcare institution, that will be possibly the best gain for me for this new role. I will start with this presentation. It's interesting. This presentation is basically about touching the doctor's inner nature, which is possibly beyond the profession, which is possibly beyond the business. We'll start with the Indian healthcare at the moment. The Indian healthcare sector is growing rapidly, expanding, digitizing and reforming. But as Shri Narulaji has said, is still struggling with the equity, quality and affordability, particularly in the sense of uniformity. Demand is increasing due to the population growth and changing disease pattern. As you all are aware that eventually NCD has taken over the infectious diseases across the board, which was very well expected in this particular era, and that has completely changed how we are going to practice the medicine in the coming years. Private hospital is expanding faster than ever. That also includes all sorts of private hospitals, even corporate groups, even the public-private partnerships are also expanding a lot. The quick question is, how do we grow without losing compassion, trust and ethics? That is the inner soul of the doctor. The Indian healthcare system is moving in right directions while need reforms which are more inclusive, which is more interprofessional linked, which is more interprofessional connected. What does the scale really mean? Scale is not only about the hospitals or beds. It also means that enough trained doctors, enough nurses, enough healthcare professionals, means HR resources, consistent quality of care everywhere, patient safety and patient trust, strong operational infrastructure, which meets the demand of the present healthcare needs. And this is what it all means. And real scale balances the quantity with the quality. That is I feel it's a very good statement. Indian healthcare system progress by mastering the scale intelligently. I mean, we are trying our best. We have not reached the destination. That is what it meant to say. The healthcare is a system, not just an infrastructure. Means whenever we are creating an hospital, whenever we are creating any healthcare clinics, we have to understand that we should not be creating it merely for the business. We are creating an institution. And India's largest healthcare institution is not the hospital, it is a system. So the National Medical Commission, what is the role of National Medical Commission? It's an apex regulatory body which regulates all doctors across the country, and that is their primary job. All other jobs are secondary job. The most important job is to regulate the medical institutions as well as the doctors. It regulates the medical education, it sets up the professional and ethical standards, its regulatory and facilitatory role. This is very important because we have to have a balanced trade-off between the regulatory role and the facilitator role, and I'll come back later on this particular issue. And strong system quietly shape everyday clinical practice. The healthcare systems are dynamic and adaptive. A system must respond to the changes. That is most important, like new diseases, technology, population need, or economic shifts. A cluster of buildings can't adapt unless it is integrated into a larger coordinated system with policies and human resources. This is where possibly we are also playing, the National Medical Commission plays some part along with all of you as an healthcare institutions. What happens when we scale too fast? Business pressure can overtake the medical judgment. The doctors feel stressed, overworked, and disengaged. Patients lose the confidence in the system. Rapid and radical changes may affect the sustainable and positive culture. What does it mean? That if you will see, if you have a too rapid and too radical changes which happens, possibly the sum of the ideology, there is always a struggle between the ideology and the realism, and this is where the sum of the ideological principles are always lagging behind, and that's where the system try to struggle and to chase them. And that is what is about when the scale becomes too fast. The fast growth without values creates a long-term problems. It may not, you won't realize in short-term time, but when you grow over a time, you will realize there's so many bottlenecks you are facing while expanding too rapidly without thinking about all these bottlenecks. What is the soul of the healthcare? The soul of the healthcare is putting the patient and nation first. That means the need of our patients, need of the health of our patients, and need of the health of the citizen of our nation, all citizens of our nation. That is very, very important. Practicing medicine ethically and responsibly, respecting doctors as professionals, ensuring fairness, access, and safety. Effective communication is the key. Robust training program, and the most important possibly destination for all of us in the future is universal healthcare access. Health of the citizens are one of the key welfare index of the nation. This is where the soul of the nation is, and we have to understand that India has best of the system. There is no doubt about it. India has given the best doctors, best professionals all over the world. India is a pharmacy of the world. Everything is there in India. Even then, why there are issues? The issues is lack of uniformity and dichotomy and diversity. That is the issue which we are facing, and that is where the policy makers, the system generators, they are struggling. And how we'll solve it, I'll let you know. How we think that we can solve it. The building stronger institution is lesson one. Healthcare should not depend on individual alone. It's a collective work, it's a collective wisdom. And as I said, the next generation of education is going to be an interprofessional education where all this healthcare healthcare institutions will connect with each other, and this is how this education will definitely get better. Focus on processes over the people. You have to focus on developing system. You have to focus on eliminating the subjective biases. So you have to go behind the processes to get it better than you go behind the people. That is very, very, very important when you want to build up the stronger institution. Focus on infrastructure to meet up the demand. Clear rules and transparent system is essential. Institution must function smoothly, and even when the leadership changes, means it should be on the auto mode. Whosoever changes, the institution runs through the system, not by the people. That is very, very important. We measure success by the quality of the institution. We built culture, incentives, and governance, not just quarterly results. The standardization with listen to is a standardization with sensitivity. The common standards improve safety and outcomes. We have to put the basics right and basics first. I think that is the fundamental. First, we have to correct ourselves with the basics, then we have to advance technically, we have to advance to deal with the complexity, but we have to put the basics right. Uniformity of the system is very, very vital, whether it is an educational system, healthcare educational system, whether it's a healthcare delivery system, whether it's a pharma delivery system, whatever, we have to bring the uniformity of the systems. But the doctor needs freedom to apply judgment, and complexity of the medical solutions, that we have to take it on account for the standardization of sensitivity, that how much complexity we are going to deal with and how best we will balance it. This is where I always, I told before, that we need at a policy institution, we need to have a very fine or balanced trade-off between the regulatory mechanism and the facilitatory mechanism. If you try to regulate too hard, the facilitation will be poor. If you try to be facilitate too soft, the regulation will be poor. So this is where we need to balance ourselves in a better position. Guidelines should support doctors, not restrict them. That should be the basic principle of issuing the guidelines. The building and technology are easier to create than skilled doctors. The numbers are easier than achieve quality. Doctor needs good training, conducive working environment. This is the major obstacle why our system is not expanding beyond the third tier of cities. Because there is no conducive environment in the rural areas, in the farthest region of India. Now possibly this infrastructure is developing and the access to this region is established. Possibly we will see some mileage in next decade, that gradually the access to these rural areas and access to the farthest area of the region will get better. So this is where when the system works together to build up an institution, this is the advantage, where you don't need only doctors, you need all the professionals together. So conducive environment, continuous learning is the most vital for doctors. They have to be the learner for the lifetime. Support for the mental well-being and the understanding. The preventive healthcare is the biggest new dimension of the healthcare, particularly after the artificial intelligence has came and when the medicine is moving towards the personalized medication. And preventive healthcare is the key to control the NCDs, which is non-communicable diseases. So this is one of the biggest aspects, and certainly National Medical Commission is going to bring this into the training of for the doctors during the formative years in undergraduate as well as the postgraduate. The healthy workforce ensures safe patient care. The lesson 4 is ethics cannot be optional or informal. Clear codes and fair practices protect everyone. The strong ethics system builds public trust. Strong foundation is very, very important to create any institution. The power to heal is also a power to harm. We have to understand. And ethics is which stands in between two. So that is very, very important. This is about the medicine. Medicine is a moral enterprise before it is a technical one. This is by Mr. Edmund Pellegrino. So what corporate hospitals can do? Balance growth targets with the patient outcomes. So they focus on patient outcomes. They invest in the staff training and development, which is HR resources. Continued efforts in creating strong academic learning and clinical research resources, which is very, very important for Make in India initiatives or for the next generation of recoveries. We have seen that technical experts like IITs have advanced so much into discoveries Defense has advanced into so many discoveries, but we are still lagging behind the doctors. This is where the clinical research resources is going to play an important role. Create internal systems for ethics and grievance redressal. Create a strong healthcare institution culture. Creating an institution culture is very vital. Provision of excellent healthcare culture service should be the main goal of corporate hospitals. Healthy finances and scalability should be the end goals of the success of your healthcare institution. The future of healthcare in India is expansion will continue, and it is necessary. Healthcare will eventually move from hospital-centric to the patient-centric. The biggest driving forces are telemedicine, e-clinic, artificial intelligence, wearables, remote monitoring, digital health IDs, ABA, and personalized medicines, which is where the medicine is going to move in next 2 decades. Institutions that combine scale with the values will lead, and they will excel. If India gets implementation right, it could become a global model for affordable and tech-enabled healthcare. So NMC's vision is again focus around all these issues of soul. We need to bring uniformity in processes and training. We need to bring the fair and well-structured regulatory system. We want to focus on professional curriculum during formative years of training, which includes good communication, empathy, good doctor-patient relationship, understanding the ethical values, and medico-legal issues. We want to focus on the training, continuous post-graduation training, where the doctors can get better. We need to expand our post-graduate ratio to such an extent that every undergraduate doctor should have an opportunity to become a postgraduate doctor, because that will certainly enhance the quality of the healthcare delivery to the society. The clinical research as an integral part of the clinical medicine, this is what we are joining hand with ICMR, with Indian Institute of Science and Technology, and IITs, and we are soon coming up with a broader agenda for both undergraduate and postgraduate students for clinical research. The balance, the trade-off between regulatory and facilitatory action, which I have already mentioned. In healthcare, scale gives reach, but soul gives the legitimacy. Thank you so much, and thank you very much.